I'm Mark Hennick. This is So-Called Normal. Hey folks, welcome to A Little Normal, which I've decided to call these little bite-sized episodes just in the last one. We're taking this opportunity in between our limited series releases of 5 conversations with 5 really interesting, passionate people to explore their journey through treatment-resistant depression and the complex pathways that it takes to navigate not only your own mental landscape inside your head, but the system, the treatment system, and the social systems that keep us stuck very often in these illnesses and these struggles that we're experiencing. So I want to bring in Dave Trafford. He's our editor on the show, my co-producer on the show, to have a bit of a conversation about Shelley, who we have coming up next week. Hi, Dave.
Hello.
So Shelley is a fascinating person who I wanted to talk to for ages. We followed each other on social media for a long time. The mental health community or I should say, the mental health advocacy community, people who do what I do, is pretty small, and you bump into the same people a lot at a lot of different types of events and advocacy type things. But I've never had the chance before this to talk to her. I'm so glad I did, because I'm fascinated by her, not only her journey, which has been, of course, challenging and really difficult for her, but also some of the things that she's tried, like transcranial magnetic stimulation, for example.
So
TMS.
Stop there. What is that? Because I know that came up.
So TMS, yeah. So this is, it's not, I think, a publicly well understood treatment, but essentially you're taking magnets, putting them on the head, and inducing a state similar to what electroconvulsive therapy does, shock therapy, but it's much, much less invasive. Now, there's a lot of stigma around ECT, around shock therapy, ever since One Flew Over the Cuckoo's Nest and all of these anti-psychiatry type advertisements of people biting their tongues and having these violent seizures. That's actually not what ECT is even like anymore. And while a last resort treatment is very effective. Anyway, that's part of what I think drives people to TMS, transcranial magnetic stimulation, because it does something very similar in terms of this idea of resetting the brain, but it does it with magnets, and it does it. You can drive yourself home. There's not nearly as many side effects like memory loss. So,
and when she was talking about that, that reset, what effectively is happening there? Because you mentioned memory loss, and I would think that would be the biggest worry in some cases, whether it's short-term, long-term, whether it's recovered or not.
I think this is really interesting because you hear about this idea of a reset or a brain reset with a few different types of mental health treatments. We were talking off mics before this about magic mushrooms. And this is something, I watch documentaries about mushrooms all the time. I've tried them several times. And people have talked about this idea that it seems to clear out the cobwebs in a way, or it seems to get things moving again in a different way. And it's almost this idea that we get stuck in patterns, whether neurologically or psychologically or otherwise. I don't know. Electrical patterns, maybe. I'm not sure. I'm not an expert in this area. But if we can break free of those patterns, that seems to be what helps to unlock people, to unstick people. And maybe that's happening with treatments like TMS and ECT and even magic mushrooms. I don't know. It gives people a chance to start from a clean slate.
Yeah, you're clearing the cache, really, and kind of giving some relief to what is a fairly overused part of your physiology. But when you look at those things, it sounds... Again, from the outside looking in, it sounds extreme when you start to describe what we're talking about. And so I can see that in many cases, it would take a lot of conversation or, maybe even desperation for this to even come up in a conversation. And it should, based on what you're saying, should be part of more of a normal conversation in terms of mental health treatments.
Well, let me ask you, to what lengths, we don't usually have personal conversations on the show with you, you're usually the hosting person, but to what lengths would you go if you were, or maybe you have, found yourself in a really deep suffering place for a long time? To what lengths would you go to break free of that?
Yeah, I haven't been, and I have, as I've listened to the individuals you've been talking to, I'm kind of putting myself there thinking, what is it that, how would I respond to it? And I would think my initial reaction would be to compartmentalize it, to try to almost ignore it. And that would kind of possibly drive me deeper. Now, without having gone there, I'm not even sure how I would be self-aware enough or to be able to step out and say, okay, enough of this. Now, I know that most people that you have talked to, they kind of got to that point. There's several of them have been in that sort of self-denial part of it. There's nothing wrong, and all of a sudden, boom, they hit a wall. So I think it's not so much what lengths would I go to, what depths would I have to go to before you get to that point. And I think that's what really struck me about the conversation with Shelley, but others in the series as well.
Well, and TMS, like I said, it's not an extreme treatment by any means, and I think more people should probably try it. The evidence is emerging on it for sure, but it seems to be fairly non-invasive. But I think it is one of those things where, people, the general advice right now, if you're struggling with your mental health, is talk to your doctor. Mm-hmm. Okay, that's good advice, and people should do that. Sometimes people are in for a bit of a rude awakening, though, because they talk to their doctor, and while many doctors, and family doctors, which is who most people go to first, they're getting better and they know more about mental health, but A, it's not their specialty, and B, they're still humans, so they're still subject to all the same stigmas as everybody else. In fact, research has shown that mental health stigma among healthcare providers is worse than other people for a variety of reasons. So I think that sometimes people go to their doctor, they don't get the experience that they were expecting, or maybe they need, or probably what they need. They leave with an antidepressant, which is fine. Antidepressants worked for me once I eventually found the right one, which was a long road. And we heard that, I think, too, in all 5 of our conversations, that nobody just got, oh, this is the medication I need, and therefore got better. That never happened, and it didn't happen with me. But that said, even medication alone, it doesn't work for everybody. There are varying statistics, but 2/3 of people, but there's still a solid 30% at least of people for whom antidepressants just don't work. It doesn't matter how many they try. So then they need to try other options. I think not enough people realize that there are many other options out there to try outside of medication.
Yeah, and you talk about the stigma among healthcare providers. They also, and as I was listening to you talk about it with the various 5 conversations, it sounded as if many of the doctors or those who are providing treatment were almost learning as they were going as well. And clearly they're educated in what they're doing, but there's a little bit of learning only because no 2 individuals are alike, and they're not experiencing their mental health challenges in the same way. You and I can both have a cold. Okay, we know how to deal with that. In this case, it really does require not only an understanding of the treatment, but the individual and how they're responding to it. So it's a far more complex circumstance than putting a Band-Aid on and leave the room.
Well, it is, but also I think we actually don't know as much about mental illness, the biology of mental illness, as we think we do, and as I think the general public thinks we do. We bandy about ideas all the time that it's a brain disorder. I mean, I guess that's kind of true, but everything is related to your brain, everything you experience. You can't experience anything without your brain. So, of course, mental illnesses are related to your brain. But we actually aren't entirely sure how. And even now, this is part of my motivation for, I'm doing another master's degree. I don't remember if I told you that or not. I'm doing another master's degree in neuroscience now. And part of my motivation for that was that I hear people just saying neuroscience all the time, or the brain science of mental illness or mental health. And then they say things about serotonin and neurons, and they clearly have no idea what they're talking about, because so many people don't. So I wanted to go in and actually learn, okay, what is the research picture? What is the science saying about the science of mental health and mental illness? And it turns out it's not very clear on the science side. There's been incredible advancements and many more exciting advancements to come, but we are just scratching the surface on how the brain changes and adapts to mental health problems.
Well, and again, not that we would want to be cheering for COVID, but in so many cases where we have seen the response to COVID-19, it has seen this intense response, particularly, for example, in finding a vaccine. you got to wonder, considering the pressures that COVID-19 is going to put on our collective mental health, the focus that that's going to take. Perhaps we are on the cusp of some of this research coming as a result of this intensity. So, if there's anything to cheer about, is that this is now being highlighted, that in fact the research is going to be done more intensely and perhaps will be accelerated.
I hope so. Dave, it's always a pleasure to chat with you, and we talk a lot more often off mics than we do on mics, but I look forward to bringing you back on to talk about the next episode as well. People can subscribe to So-Called Normal on Apple Podcasts, Google Podcasts, Spotify, Stitcher, Deezer, YouTube, everywhere else. Everywhere you get your podcasts, you can subscribe to So-Called Normal. We're doing these little normal quick episodes in between our limited series of 5 conversations with some really fascinating guests about treatment-resistant depression and complex treatment pathways. So come back next week. I'm Mark Hennick, and this has been So-Called Normal.
This episode of So-Called Normal is brought to you by an educational grant from Janssen Inc. Mark Hennick and the producers of So-Called Normal are solely responsible for the content of the episode, and the views and opinions expressed in this episode do not necessarily represent the views or opinions of Janssen Inc. The podcast content is provided for informational purposes only and is not intended as medical advice. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, product, or treatment. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in this podcast episode.